Good morning, everyone. Good morning. I hope you all had a great evening yesterday, and we're about to get started on our second day of the town hall. I am Michael Atkinson. I am part of the core team, and I'm here with construction management. And I also have with me as a co-host today is Lisa Utsami. She's going to be our technical support, my host, my backup support for anything that goes on today. But we want to welcome you here to the second day of Race and Attention, Healing the Wound That Would Not Heal Itself. Again, we thank the Department of Equity and Inclusion for allowing us to put this on, and our awesome city managers, Marshall Adams David, Evan Raleigh, and our Deputy City Manager, Tansy Hayward. So we have a lot in store for you today. So we hope that you are excited as we are. So with that being said, welcome to those who are new and welcome back to those who was with us yesterday. If you were with us yesterday, we had an awesome time with Dr. Aaron Moore and Mr. Danya Perry. They both gave us some phenomenal presentations yesterday. We were thoroughly filled and fulfilled, and we just thank them tremendously. I believe Dr. Moore is on with us again today to take part in the festivities of the day. So we welcome her as well too. We thank you for joining in on the all things that the city has to do. Again, we thank you so much, Dr. Moore. With that being said, do what you need to do to take care of yourself. You know where the refrigerator is if you need a snack, if you need something to drink, you know where the bathrooms are if you need a bio break. But whatever you have to do, we want you to take care of yourself. But most importantly, we want you to stay engaged today, and we want you to be actively participating on today. And we know if you have any questions, drop them in the Q&A box so that way we can compile these questions that may not get answered, that we can send them to the presenter so that they can give you a thorough answer and response back. And we will have those answers published for you as well so that you would know that your answer was important and that the presenters took your question seriously and that you will receive an answer. And so for our learning environment, we want you to learn as much as you can learn here on today, but we also want you to share the information that you learn here today. It does us no service if we withhold that information and if we talk about change. So with that, we want you to share it. Tell someone in your community, tell someone in your office who you work with, your religious affiliation, whatever the case may be. We want you to share this information. This is a brave space. No one will be casting judgment. We are all here for the same information to learn, to grow, and to help our realm of influence to go beyond what we have imagined or thought of. And this is one conversation. We are going to be talking the same subject, because if we allow too many of the outside influences to take away from the hard work that our presenters have put in. And with that, we want you to understand and accept and expect that there will be a lack of closure around this topic. This topic would always be ongoing. So we want you to be able to get the answers that you need, get the knowledge that you need, but also understand that there will be no closure for this. But we want you to listen for understanding. Part of the growth and part of the healing part is being able to listen and accepting the knowledge to pass. And that's the only way that we can move forward. So why do we talk about racial equity? We know that we live in a highly racialized society, and that the very foundation of this country, it has its biases in race. And we know that some progress has been made over the years, but if you look at any measure of outcome of success in our income, our education, healthcare, criminal justice system, significant differences in outcomes based on race remains deep and pervasive. And we're having these conversations today, having this town hall today, because of the organization's desire to be intentional about creating equitable outcomes where everyone can succeed. So what is meant by intention? Intention is something about one intends to do or aim to plan. And also in a medical sense, It is the defining of a healing process of a wound. And we are in a great treat for today because Dr. Caesar is going to be relating the medical aspect to intention. And so you're in for a great treat on today. Yesterday, we had the phenomenal Dr. Moore who presented to us on Race as We Know It. We left with a great understanding of the history of the construct of how we got here. She broke down the binary divisions that we had. She gave us 4 words that we had to think upon. And her presentation was just amazing yesterday. She taught me a whole lot about the Hegel, she just broke Hegel down, and she dispelled the binary divisions of how we can heal. She gave us the roadmap, and we are so appreciative of her. And we will have these recordings posted so that you can go back and watch. If you missed anything, you can go back and you can take notes. And then after Dr. Moore presented yesterday, we had Mr. Danya Perry that gave us a presentation on race as we learn it. We developed a shared analysis of how race impacts our lives, the struggles that persist, coming from privilege to being an ally. He gave us a great little work session there to determine our privileges and measure up. And we saw that some have more privilege than others, and some was a reflective moment of where you came from in your upbringing. That which you thought was privilege, it really was a struggle, but you overcame it. And he left us with his 3 R's: reach in, reach out, and reach over. That's the only way we can be a better community, a better city, a better county to each other. And on today, Dr. Caesar is going to expound on race as we see it. So when you leave today, you will have a you have a better understanding of how structural racism in the US exists with our current examples and our healthcare systems. And she goes beyond. Dr. Caesar would not be here live with us today, but I did have the privilege of sitting with her over the weekend to record her session, and I promise you, you're going to be in for a treat. I was captivated, even if it was just me or her. So I know that you are going to be thoroughly captivated as well. So next, we're going to have a message from our city manager, Marcia Adams David, and our assistant city manager, Evan Riley. They both have been a great support system for us and been dedicated to promoting this work that we have been doing over the past 1.5 years. And it has grown and it has expounded, and we know that the work must continue. So without further ado, here is a welcome from our city managers.
Hello, everyone. I am Marshall Adams David, City Manager for the City of Raleigh. I'm so excited today to welcome you to the 2nd annual Raleigh Town Hall, Race and Intention, Healing the Wound That Will Not Heal Itself. This is important work, it's tough work, but it is work that we as a city and community share a deep commitment to. Joining me to talk about where we are and where we're going is Evan Raleigh. Evan joined the leadership team last year as an assistant city manager. Welcome, Evan.
Thank you, Marshall. It's a pleasure to be here, and I'm so grateful to be a member of this team. As one of your assistant city managers, I have the pleasure of working with several departments. The 2 most recent additions are the Office of Community Engagement and the Department of Equity and Inclusion. Related to equity and inclusion, we recently announced a new leader of that department, Dr. Artina Hamilton. Dr. Hamilton brings a wealth of multicultural competence and experience helping guide policy and programming to strengthen organizations.
We are pleased to welcome Dr. Hamilton to our team. She will help us build a more unified and more inclusive Raleigh. There are other important steps we have taken as an organization to encourage and normalize discussions about race and equity. We created the Equity Core Team with representation from every city department to advance inclusivity. An example, the core team has been charged with putting on today's town hall. This is meaningful work that we will all benefit from, so thank you.
Between March and November of 2021, nearly all City of Raleigh staff, almost 4,000 people, successfully completed a 4-hour training session. These Equity 101 interactive sessions were facilitated by staff and gave participants the opportunity to examine the history of race relations in our country and have candid conversations about their own personal experiences. It was important to us that this exercise not just check a box, but provide an opportunity for meaningful conversation and learning. We were pleased to receive so much positive feedback about these sessions. Many staff members were inspired to learn more and pursue a better understanding of issues surrounding race and inclusion in other areas of their lives, not just in the workplace.
These are important steps, and I am proud that our organization is having meaningful conversation around differences and ultimately similarities in what ties us together. Another great resource is our upcoming Equity Toolkit. It will help to evaluate internal biases in contracting. We want to ensure that we are reviewing internal hiring practices as well as who we contract with through an equity lens. Healing the wounds that separate us is work that requires us to look beyond the City of Raleigh into our broader community. We are partnering with other organizations, area universities, county and regional groups that are also committed to equity and inclusion efforts. Evan, any final words for today's town hall participants?
I just want to say thank you. Thank you for the work you have done thus far and for the work you're about to do these next 2 days and beyond. It takes all of us examining our hearts and our minds and making space for difficult conversations to move forward. While there is much work that lies ahead, I feel confident that we are making progress toward becoming the type of organization and community that we want to be.
While we may not be able to fully erase the ills of the past, we can all work together to create a better future for all. As you participate in conversations and listen to presentations, I challenge you to be intentional. In order to begin the healing process, we all need to be willing to listen and acknowledge the past in a way that is meaningful so that we can increase awareness and move ahead. Create opportunities to have courageous conversations. You have more influence than you think you do. Take what you learn and encourage others to engage too. We are all part of the solution for reaching my vision, a Raleigh for all.
We thank our city managers for that very warm welcome and the task and the charge that they have placed before you. As I stated before, Dr. Caesar is not here live. However, we do have her recorded session, and I thoroughly believe that you are going to leave here with more knowledge about the healthcare system and race as we see it and the parallel to the two and how we can heal and move forward. She is a phenomenal person, and without further ado, let me introduce to you Dr. Andrea Caesar. In September 2021, Dr. Andrea Caesar joined the UNC Health team as its inaugural Chief Diversity, Equity, and Inclusion Officer. In this role, Dr. Caesar oversees the DEI and health equity efforts at UNC Health and UNC School of Medicine. Dr. Caesar went to UNC Health, leaving the city of Raleigh, where she led the city's first Department of Equity and Inclusion. In this role, she develops Raleigh's first racial equity action plan, emphasizing workforce equity, police community relations, business inclusion, and community engagement, and served as an advisor to the mayor and city council on issues related to community health, social justice, and equity. Prior to her time with the city of Raleigh, Dr. Caesar held several positions where she has helped organizations better understand the social determinants of inequity. As Director of Community Outreach and Support for Union County's Department of Health and Human Services, she founded the Union Health Equity Collaborative, which trained over 150 providers and staff from Union County Public Health, Atrium Health Union, Novat Health, and members of the community on topics related to social determinants using Union County specific data. Dr. Caesar is also an adjunct professor in the School of Government Teaching, courses in the Master of Public Administration program. We are so excited to have Dr. Caesar return and offer her insights and knowledge here at the town hall today. She knows the city of Raleigh very well, and she knows health equity. So let's hear how she brings this intersection to light. And so without further ado, I welcome to you, Dr. Caesar.
Greetings. I'm Dr. Audrea Caesar, and I'm really excited to be here with you all today to talk about health and healing at the second annual Town Hall on Race and Equity. I want to thank the chairs of this planning committee, Michael Atkinson and Letitia Holmes, for inviting me here to speak with you all and to share this important message. I'm going to start off with Dr. King. Dr. Martin Luther King is one of the greatest minds and figures in history as it relates to civil rights and equity. And Dr. King's quote on health is often taken out of context. So I want to take some time and just read it to you and share the appropriate context. Of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death. I believe that Dr. King had a much broader scope with his definition of health. In addition to healthcare, he was addressing the environmental conditions, sanitation, jobs, economic growth, housing, and education, and all the things that you'll find in his speeches and sermons throughout his life, which is why we celebrate his legacy and his vision. King was essentially laying the foundation for eliminating health disparities, and he spoke about it in a way that looks very similar to what we now name the social determinants of health. The social determinants of health, according to the CDC, or Centers for Disease Control and Prevention, are the places in which we live, we learn, we work, and play that affect a wide range of health and quality of life risks and outcomes. It's virtually impossible to speak about any of these determinants without referencing the other determinants. The American Hospital Association states that only 20% of a person's health is directly connected to healthcare. The other 80% are the circumstances that people find themselves in. Again, where you live, what kind of job you have, your level of education, what your community looks like. In our daily jobs, we should always be thinking about health in a broader sense. So today, I'm going to focus on health and healing. We'll talk about the collective trauma in the pandemic that we're all facing right now, the extra burden for people of color related to health. I'll provide some historical examples of medical atrocities that limit trust in health, particularly for people of color. And I want to emphasize people of color because this is Racial Healing Week. So it's important to say what has happened and name it. And then, I'll finish up with what it takes to heal for most of us. And I'll share why I say just for most of us. Okay, to get started, I want you to close your eyes and think about yourself that last month of normalcy before COVID-19. So close your eyes and think about that last month. What was it like? What were you doing? What were you concerned with? What were you feeling? As you do that, if you have an option available for the chat or Q&A, go ahead and put it in the chat or put it in the Q&A, what you were doing, what you were thinking, and what you were concerned with in the month just before COVID-19. I'll give you a minute to do that. And while you're doing that, I'm actually going to share with you my experience. I'm going to do the same exact thing you're doing. I'm going to close my eyes and reflect. So in late January, early February of 2020, we were in Florida at Disney World, and I was standing in front of Space Mountain impatiently waiting for my kid to finish her icy before we got in line. But then I got a text message, and that text message was from my mother, and she let me know that Kobe Bryant had passed away. That text message was followed by an ESPN alert. My husband was getting the same alerts. So we looked at each other thinking, this is crazy. How could this happen? You know, we were expecting Kobe's death to be the most unexpected thing about 2020. Boy, were we wrong. So wrong. So, you know, we decided to go home early. And when we got to the airport, we were slightly irritated because the lines were longer than normal. I mean, 3 times longer. And you could see that folks that were coming from international flights were getting their temperatures taken. Nobody had masks on. It was not a big deal. We just, you know, got on a plane and came home. 3 weeks later, everything changed. My kid was at home. I was no longer going into work, and our lives were completely uprooted. Now, at this point, Disney World was just a distant memory because everything we had known and taken for granted had now changed. So that brings us to this point about COVID-19 as a single pandemic. And I would suggest to you that we're actually going through multiple pandemics at the same time. We've got political unrest, a social justice movement, the digital divide for students. Kids in my daughter's school didn't have laptops. I watched Wake County scramble to get kids Chromebooks, and then they didn't have internet access. So then we had to find MiFis and all of these things so that folks could continue to be connected. We experienced racism, sexism, anti-Semitism, xenophobia, and homophobia. All of that was happening during this monumental social justice movement that mirrored the civil rights movement of the 60s. All of these things are happening. And in 2021, we saw the collapse of our supply chain. And we're experiencing now the Great Resignation. People are leaving their jobs in droves. All of this has created a climate of mental health. It's important for us to think about the health and well-being of how we function as a collective society. And the reality is things are very different now. People are tense and on edge to the point where anything could happen. And we're seeing it show up every day. We're seeing increased violence. There used to be a time where kindness was at least socially acceptable. That looks very different today. And I would venture to say that every group, every American, and every global citizen from countries around the world are experiencing this mental health crisis. Suicides are up amongst our kids. Mass shootings seem to happen every day. And things just aren't the same. Here's an example. In the picture, Well, really, this is surveillance video where we've got a cashier at a restaurant. Some of you may have seen this. But the woman was dissatisfied because she got the wrong soup. And the cashier offered to replace the soup and refund her money if she didn't want that. But the lady decides that she's going to throw the soup in the woman's face. She was later arrested for assault charges. On airplanes, we're now seeing more and more people get upset because a flight attendant says, please pull your mask up. And somehow being asked to pull your mask up sends people into a rage that ultimately gets them removed from the plane. And how about this one? This guy got so indignant that he was just yelling and screaming and spewing all types of profanities. And he got to the point where he actually attacked a flight attendant. So the flight attendant requested all able-bodied men to come to the back of the plane where they collectively duct tape him to his seat. You can't even go to a restaurant without seeing some type of a sign that says, be kind or leave, or service may be slow. Nobody else showed up today and I have a cold. Honestly, I don't know if I would be eating there, but you know. But folks who are working in service jobs are being attacked for enforcing mask mandates. They're being attacked for slow service. They're being attacked for anything under the moon. And all of this is a result of our collective mental health. Our collective mental health is something that is suffering and it won't be fixed overnight. I'd like to argue that for people of color, this is continued health trauma. Every day we're talking about displacement due to gentrification and natural disasters. I don't know if you all have heard, but Raleigh is the #3 housing market in the country right now, #3. And while that's amazing, we know that people are being displaced. We know that the wealth gap is getting wider and wider. If you've gone to purchase a house in the last 6 to 7 months, chances are you had to bid on that house. And in order to win the house, you would have to come up with at least $100,000 over list. Realtors are saying that homes are going now for at least 12 to 14% over the list price. So you've been saving up your entire life and you still can't afford to buy that house because someone who is much wealthier than you can afford to pay above and beyond what that house is worth. Experts are saying the market's not going to slow down anytime soon. So what does that do for people of color and folks who are living in poverty? Housing. We've known for a long time that people of color tend to live in places or located in areas where there's low land value, further depreciating the value of their home. We know that homes for people of color have been settled close to toxic waste sites, landfills, and flood zones. I didn't realize until I was 30 years old that I grew up in front of a solid waste dump. I didn't know what it was, but we would walk past it. And see, where I'm from, we don't have subdivisions, you have blocks. And this particular waste site was 1 block away from my house. Who knows what was in the water? Who knows? We don't. And that's the problem. It shows up later in the form of cancer and other health issues. Healthcare in general for people of color has been a sticky subject because there's been a lack of trust of healthcare and doctors. So when you talk about vaccine mandates and newer and exploratory treatments, such as monoclonal antibodies, there's no surprise that people are not running to get these treatments, even though those treatments can be life-saving. There's a stigma around mental health. I just showed you earlier that collectively as a society, we're struggling with mental health. And therapy, even today, is still seen as being for whites. A bigger problem is medical provider unconscious bias and conscious bias against patients. When you think about someone as prominent as Serena Williams telling the doctor that she needs certain treatment and being ignored and almost losing her life, it blows your mind. Because if it'll happen to Serena, it'll happen to any woman of color. So, this is an opportunity for you to put some information in the chat again. So, what do people tend to cite as the primary reason for distrust in healthcare and medical research? I want you to put that in the chat or the Q&A. What do people tend to cite as the primary reason for distrust in the healthcare system and medical research? Just take a moment to put that in there. So if you said the Tuskegee study, you would not be alone. The vast majority of people cite the Tuskegee study as being the number one reason why we don't trust the healthcare system and we don't trust doctors or researchers. But, I would argue that Tuskegee is not the sole reason why Black people and other people of color don't trust healthcare. It's just one isolated incident. Now, for those of you who are unfamiliar with the study, the Tuskegee study of untreated syphilis in the Negro male was conducted between 1932 and 1972 by, wait for it, the United States Public Health Service and the Centers for Disease Control and Prevention. 600 men were enrolled, 399 African Americans with syphilis were chosen for the study. The intent of the study was to record the natural history of untreated syphilis in Blacks. Let me say that again, untreated syphilis in Blacks. So you're telling me they wanted to investigate the progression of a disease, not aim to treat the disease? That's exactly right. And that's exactly what happened. On July 25th, 1972, Jean Heller of the Associated Press broke the story that the study had been happening. And at that point, there was such outrage, international outrage about the study. Eventually, a commission was formed, and it had gone through the process of a review. And in the review, they came to the conclusion that, well, all of the men willingly participated in the study, but what they left out is that there wasn't informed consent. Informed consent is when you are notified about the risks and possible side effects and what could happen to you as a result of the study. That made it completely unethical at that point. In 1996, it took that long. In 1996, President Clinton acknowledged the atrocity, and the families were rewarded a whopping $9 million for 399 African Americans and their descendants and their family members. So it didn't go very far, but at least it was acknowledged. When we talk about acknowledgement, there's a book that I'll say changed my life as it relates to understanding medical research and medical experimentation. And the book is called Medical Apartheid by Harriet Washington. This book explores the dark history of medical experimentation on Black Americans from colonial times to the present. And teaser, there's a couple of things on here that I think would be of interest if you have time to read it. One is on HIV drug experimentation on children. It's ghastly just to see that. The withholding of HIV medications from African Americans and the medical abuse of enslaved Africans in America. Eugenics and genomics are also featured in this text. I'm going to take a moment to talk about some of the things that I learned from the book that I felt were most striking from a woman's perspective and from a human perspective. J. Marion Sims, he was considered to be the father of modern gynecology. He attended medical school at Jefferson College, where he described himself as a mediocre student without ambition for the medical profession. He's best known for conducting medical experimentation on enslaved women without anesthesia. So as the story goes, J. Marion Sims was in the New York area, New Jersey area, Philadelphia, Philly. And he finished up at Jefferson College and then moved to rural Alabama, where he started the first slave hospital, and not specifically the first slave hospital as if they didn't exist, but the first slave hospital that conducted medical experiments. He actually purchased a total of 11 slaves. And these slaves were ones that had medical conditions who really needed care. And so there's 3 particular slaves that we know of in history that were named. One named Anarcha, one named Betsy, and one named Lucy. So these 3 slaves were the subjects of most of his experimentation that led him through a number of breakthroughs, including the creation of the speculum. His fascination with Black bodies that led to the stigmatization of reproductive organs, which is the stereotyping of Blacks as hypersexual. Let me say that again. It was the fascination that led to the stigmatization of the reproductive organs of Black bodies. You see what I did right there? I went Jesse Jackson on you and you missed it. So the reason why we have all these stereotypes today is because white women were considered to be chaste. Men of any race could not look upon a white woman. But when African slaves or enslaved Africans were taken to be a part of this hospital, they could unclothe them. They could remove all of that clothing and all of that dignity with it and be looked upon and be tested and researched. And all of these things lead to the stereotypes that we have today when we see Black women versus white women. So this picture depicts exactly that. It depicts J. Marion Sims and Betsy, one of his slaves, looking at each other. She's looking at him and he's looking at her. And he's looking at her in a way that says, this is my subject. What can I do to solve the world's problems? And how can I contribute to women's health through this slave? You can see the 2 on the side peering in. These 2 women were the other slaves, Anarcha and Betsy, and Lucy, excuse me. The other men were assistants and some other medical providers who were invited to come and view these surgeries. Some of the surgeries became so intense that the other doctors left, and the enslaved women were left to hold each other down while J. Marion Sims performed all types of surgeries without anesthesia. Eugenics. Eugenics is something that we've seen throughout history, but fundamentally it's a set of beliefs and practices that aim to improve the genetic quality of a human population, historically by excluding people in groups judged to be inferior or promoting those judged to be superior. Specifically through the period of 1890 and 1930, white scientists were obsessed with the future of their country's gene pool, and they wanted to propose a way to give more suitable races a better chance of prevailing over less suitable races. Inferior races were seen as a drain on the economic, political, and moral health of American life. This caught the attention of Nazi Germany, and they carried out a campaign to cleanse German society of individuals viewed as biological threats to the nation's health. We know that today is the Holocaust. Even still today in the United States, many covert practices have been used well into the 1990s and the 2000s. And they show up in things like cloning and genomics or designer genes. And I don't mean designer genes that you wear, I'm talking about DNA, right? So some lesser known reproductive health woes, the Innovid study in Puerto Rico. This was the first large-scale human trial of birth control pills carried out in Puerto Rico in the 1950s. Before the drug was approved and safe in the mainland, they had to test it. So they found Puerto Rican women to test it on. Now, there are mixed reviews in terms of if the women gave consent or if they were coerced to be a part of the study. But ultimately, the trials were conducted by Gregory Pincus and John Rock in 1955. The health risks were originally hidden from the women testing the contraceptive. What happened was they began to show side effects: nausea, dizziness, headaches, and blood clots. The complaints were, however, dismissed, and the women were deemed unreliable. So here we go again. I am a woman, and I'm telling you that I'm experiencing these symptoms, but yet my feedback is deemed unreliable. Ultimately, 3 women lost their lives as a result of this study. Another lesser known fact is the forced sterilization of Native American women in the 1960s and 1970s at the hand of the Indian Health Service. Native American women would go into the doctors complaining of stomach pain and end up walking out with a full hysterectomy. They would go in for simple things like cold or a headache, and somehow they would end up with either their ovaries removed or their tubes removed. All of these very serious and major surgeries. But this happened for years and years before it was brought to light. These are the types of things that put people in the position to say, no, I don't trust healthcare, and no, I don't trust doctors. So now we move towards healing. We've talked about some of the historical things that have happened that limit trust and really limit the opportunity for people of color to truly experience health. We've talked about our collective mental health as a result of the pandemic and the very real challenges with vaccines and the very real challenges with all of the multiple pandemics in general. Now we're going to take a shift towards healing. When we talk about racial healing and health, it boils down to some very simple and basic concepts. It's about telling the truth about the past and present systemic issues and their consequences. Racial healing will happen when there's accountability. And accountability is about, again, telling the truth, but this time preventing additional trauma. The past few slides, I talked about all of these experimental studies that happened without informed consent. All of the participants did not know their risks and could not make a choice of whether or not they wanted to protect their own health. That decision was made for them. And that's an atrocity. It's a horrific reality of our system. But we can get past this. It's important that we partner with communities for solutions. A lot of times the medical community and researchers who have done all of this work and study in this space believe they have all the answers. But really, the answers lie with the people. If I have a headache and I go into the doctor and they say, we're just going to give you some Tylenol and send you home, that doesn't address why I have the headache. And the only way you're going to get the information to understand what else is going on in my life to cause me to have this headache is to talk and to listen. And once that listening happens, it's about implementing shared solutions. And dare I say this, but there should be some level of compensation and public acknowledgement for the victims and families of wrongdoing. Now, I mentioned early on the Tuskegee study and the settlement amount of $9 million, which is just a drop in the bucket. But when we think about this larger systemic issue of racism, what would it actually take to compensate or repair, if you will, the relationship? What is enough? What type of compensation for families of enslaved Africans who've been here for generations and built this entire nation? Okay. So collective trauma requires collective healing. So as we think about how we're all in this pandemic and we're all figuring out how to just get through it, if we can just get through it, if we can just be to the point where we can take our masks off, we can just get everybody vaccinated, we can just get kids in school and stay in school safely, all of these things would be better in our minds. But the reality is, it's not going to happen. It's not going to happen because we have to get to the point where we recognize and value humanity, which means valuing each other. And we're not there yet. We need to build new and repair old relationships with the people in our sphere of influence, people you work with, people you live around, people you interact with in these daily interactions. We need to learn about our differences and accept them. It's okay to be different. It's okay to have a different perspective. But when we get to the point where we are so polarized that we can't even hear what the other person is saying or what the other thought process is, then we're never going to get to the point where we can heal collectively. We need to start where people spend the bulk of their time, work. Healing collectively means that in the workplace, we've got to allow time for people to process what's happening to them personally, in their personal lives, with their families, and then also what's happening in society. This idea that society doesn't impact work is a joke. And the reality is 2020 showed us that. There hasn't been an opportunity in this 2 years for us to stop and to breathe as a society. But that's what's needed. For children, this has to begin in schools. We have to start teaching children about healing and valuing each other, because I think that is where the kids can take a different approach than the parents. We never have to get to this polarized society in the next generation if we can prevent it. Support from faith-based organizations, communities, and also government. Government is going to play a huge role in our collective healing. We've got to be able to engage with residents and be able to create partnerships that are built on trust. And I have this trust cycle here. And the reality of it is this: you can't have a positive relationship with something you don't trust, or someone you don't trust, or something you don't trust. in order to have trust, people have to operate in truth. Without truth, there's no transparency. And without transparency, there's no trust. So again, without truth, there's no transparency. And without transparency, there is no trust. And without trust, there's no collective healing. So this idea of collective healing is a long-term thing. But there's some work you can do individually around racial healing. One, it's knowing your racial identity. It's exploring your internalized racism. Regardless of who you are and what your racial and ethnic background is, you can still be exposed to internalized racism, or you have internalized racism. None of us chose to be born when we were born. None of us chose the parents we were born to or the location of the country in which we were born to. All of these things are happenstance. So we can help ourselves by relearning the history of racism, grieving racism as this being a part of the culture that we live in, accept it together, and then reclaim your whole self. Knowing who you are, knowing your history, and then knowing that you're going to be an ally moving forward. And then finally, you want to engage in collective healing. There needs to be a space where folks can get together and share their stories, where others listen. And sharing your story and listening, and then accepting what you're hearing, and then feeling compassion and empathy is what leads us to this racial healing. I would say that 9 out of 10 folks, if you ask them, say they want to heal. They want to get better. They want things to get to a point where we can all exist together, our families can be safe, and we can start to love one another again. But as I said early on, not everybody wants that. While unfortunate, it is a reality. So you start with the folks who are willing, and you continue to build until you get to a point where the critical mass says we want to be about healing. And that's when things will change. And that's when things will get better. It's a long process, but I would encourage you to stay the course, because staying the course is what's going to get it done. If it took 402 years for African Americans, and if it took 500 plus years for Native Americans, and then all other groups to follow to experience racism in this country, you know, it's going to take a lot longer than a couple of meetings, a few trainings, and some kumbaya moments. We are preparing the next generation. And if we can get really clear about that, I think we can make some real progress. Now, I didn't want to end on a sour note. I wanted to end on a positive note. So this picture, and of 2 angles, one is clearer than the other, is called The Mothers of Gynecology. I talked about J. Marion Sims, who was the gynecologist that took enslaved women and performed these surgical procedures. But these surgical procedures led to several breakthroughs in gynecology that we use today. And so the sculptures honor the 3 slaves, Betsy, Anarcha, and Lucy. It honors them, and it sits in Montgomery, Alabama. And the sculptures were just commissioned in November of 2021. So that's a step in the right direction as it relates to healing. If we can start honoring the legacy of people who gave their lives, and while maybe not of their own accord, contributed to what we see as modern day healthcare. We need to honor them, and we need to tell their stories. And this is an example of telling their stories. So with that, I conclude my presentation today. I thank you all for your time and attention, And I encourage you all to take those steps towards healing because we all need it. And it's a part of our existence as humans and a part of humanity. So thank you.
Ooh, thank you, Dr. Caesar. Thank you, thank you, thank you. You have really driven home what we were intending for this whole 2-day event to be. And we can't thank you enough for lending of your dedication, of your time, and your expertise in your subject matter. We knew that you was going to captivate us, as you always do. but we are so appreciative of you just sharing of your knowledge and your wealth, in your wisdom that you have with us today. I have one question. The question that I have is, currently, with your current role that you play with UNC Health System as the Chief Diversity Officer, what is the data showing for the people of color? Is the data showing around COVID-19 that more of us are starting to really trust the system to get tested and vaccinated? Or are you saying that the data supports that it's still stagnant, not enough trust, and there's still that small glimpse of hesitancy and apprehension around the whole makeup of the mandating of vaccines and getting the test just to see?
Yeah, so the question is multifaceted, but I'll say this. Early on in the pandemic, we were seeing African Americans being 3 times as likely to test positive for COVID, 3 times as likely to be hospitalized, and 3 times as likely to die. As the pandemic has moved on, we've seen that change a bit, where we have our Native population having the highest rates of infection and even hospitalization in some cases. At this point, our efforts like Cover NC, which UNC Health was a part of, in partnership with the state of North Carolina for the monoclonal antibody distribution and mobile testing, has really changed the game in terms of getting out to people and finding where the needs are. People who can't get to a hospital or a testing site or don't have time to sit at the PNC arena for hours and hours on end. So we found that the mobile testing as well as the mobile vaccine approach worked. So I'd say mid-pandemic, we saw cases for African Americans drop substantially. Where we are today with Omicron is a little bit different. So enter the vaccine. Once the vaccine came into play, then we started seeing other groups creep up. So African Americans, their rates were looking very similar to other groups as it related to testing and vaccinations. When Delta came, it was a different story. It was as if all the people who wanted to get the vaccine got the vaccine. All the people who wanted to wear masks were wearing a mask. And then the folks that were left were just left. So those are the folks who are still claiming Tuskegee as their reason for not getting vaccinated and not wearing a mask. They're still out there. So the rates came back up again. But what we're seeing right now with Omicron is a little bit different. So the Delta spike, so if summer of 2021, you saw Delta, we're seeing more white Americans testing positive more than other groups. And we're also seeing deaths for white Americans go up. I wish I would have known the question because I have a beautiful graph that I want to show you right now.
If you want to show it, you go right ahead and show it.
We need to show that. So we're going to pause it and I'm going to just pull it up. Okay, so thank you, Michael, for the question. And it prompted me to bring up this diagram, and I hope you can see it all right. But this is the COVID-19 weekly deaths per 100,000 population by race and ethnicity in the United States. So as I was saying earlier, early in the pandemic, African Americans were dying at a rate 3 times higher than all other groups. And we see that changed. And the change is attributed to direct outreach to different communities of color. And through our mobile vaccine unit and our mobile testing from UNC called Cover NC in partnership with the state of North Carolina, we were able to have an impact. And I'm glad that we can show that we're having an impact. I want to emphasize that this is for the United States specifically. So across the country, if you look at the group with the highest number of deaths, it's the American Indian and Alaskan Native population, if I can spit it out. You can see that amongst deaths, look at it, they've got the highest rate. So that's extremely problematic, and it's something that we haven't talked a lot about. But look at Delta. You can see kind of the peak here where Delta jumps in and everything goes way up. But look where African Americans are now. They're down here. So targeted outreach works. And we've seen that across the country. Now, if we look down to this area here, this is still Delta, by the way. We're at the point of Omicron. And while deaths have fallen off, we know that to be true because Omicron is less severe in terms of sickness than Delta was. So if we're looking at deaths, Delta's at the peak, then Omicron is down here. So this is misleading. Cases are higher with Omicron, but deaths are lower. So that's what this is showing us.
Thank you all for, as you can see, Dr. Caesar really was thoroughly mind-blowing for me during that moment. I hope that she was the same for you as well. And I hope that you was able to learn something. As I stated before, because Dr. Caesar was pre-recorded, any questions that you have, please drop them in the Q&A box so that we can capture them and that we can send them to her so that she can thoroughly answer your questions and that you can feel that your question that you may have had can be answered, okay? With that being said, I just want to highlight some things that we have done within the city of Raleigh on advancing racial equity in the government. And we hope that you have enjoyed this experience thus far. And so before we go and before we close, as you know, this is our earlier let out of a session today because we only have one speaker for today, but we still want you to leave here with some more information and to shine the spotlight on some things that the city of Raleigh has done within this past year and a half. And we want you to hope that this sparks some ideas and opportunities for you to reach in, reach out, reach over, as Mr. Perry gave us on yesterday, the charge that he gave us on yesterday. So some of the work that is on the horizon, the accomplishments that we have done, the Racial Equity Lens Toolkit. As you heard earlier in the welcome, you heard our city manager, Marshall Adams, speak on that. And what this toolkit does is apply the lens to making sure that we are promoting equity and diversity across the whole board. And we know that this part here, using the equity toolkit, is starting to be transmitted across the whole city organization. We have Raleigh Water has also created their own toolkit within their own department that is aligned with the equity action plan that we have here as part of the core team. And they looked at the workforce equity and they want to, for the promotions and the retention for middle management, to mirror that of the community of racial demographics that we hear at the city of Raleigh. In our workforce equity, we have some different initiatives that have been taking place, and that looks at our hiring practices, offering the pipelines of internships and apprenticeships, mentoring, and professional growth and development. And as you can see, the different departments that are really engaged and actively putting these initiatives at play. And we know there are other departments that are in the beginning stages of developing their workforce equity plans to their department. Some of these departments are larger and some are smaller. So, and some departments are joining together, but they are still moving the meter further and further, and they're coming together in collective, sharing the knowledge, and they're dismantling this information across the whole city. And it lets us know that we are dedicated and committed to the work, and that we want to bring the diverse representation here to the city of Raleigh that makes up the whole construct of Raleigh, and a Raleigh for all, as the city manager stated earlier. And so we want to develop recruitment strategies that ensure the city attracts and hires diverse, highly qualified candidates, as I stated a few moments ago, while leveraging the strengths of the local workforce. And equity in the budgeting and the budget equity toolkit and funding for equity. This is applying the lens across the budget to make sure that we are really looking at promoting diversity and equity within our contractors, our subcontractors, our vendors, the MWBE, not just striving to reach the 15%, but to go beyond that, to really apply that budget lens and that equity toolkit to the budget to make sure that we are closing the gap, and that we are being inclusive, and that we are being equitable, and that we are promoting diversity within our budgets and our different departments. And that a lot of these departments, planning and dev and budget management services, have been intricate and key in actually getting this information out to us. And I would just highlight Planning and Dev. They launched the equity fund identified in the equitable development around transit report, and that's been completed for the fiscal 23 budget with a multi-year phase. And budget management, their specific next steps include equity related questions in supplemental form for the budget request. So training is going to be going out through the budget with equity lens, and a volunteer program with evaluation through the equity lens. So those are some of the next steps that we have with the budget equity tool. And Planning and Dev, and also they have been working with a consultant to review their comprehensive plan and several other related documents for equity. So, and not just Planning and Dev, I do know that there are some other departments, as I stated before, they're in the beginning stages, really beefing up their help, because some departments have, some of the core team members have been phasing out, and we've been replacing and moving. So we're trying to get things back settled, but we have still been committed to the work, and the work is still moving forward. So I would like to commend every department that has done work this past year and a half to really push equity and diversity. Our departmental business plans, as you can see here, Raleigh Water, Budget Management, and practically all the departments that are represented of the City of Raleigh organization has developed their business plans around the equity lens and applying it to a way that it will be a Raleigh for all that makes up our whole community of the citizens that we serve on a day-to-day basis. The Office of Sustainability, shout out to Megan Anderson, who's the core team member and the sustainability manager. She was also intricate in this as well too, to apply it to a sustainability lens. And there was some equity assessment done on the initiatives of this with the City Council, and staff is now working to prioritize initiatives for the funding opportunities, Raleigh's Equity Impact Matrix, Raleigh's Community Climate Action Plan. So she's done a lot of work. And I know it's a small department, but they've been large in number in regards to promoting the work and doing the work of equity and inclusion. And with the support of the core team and the Department of Equity and Inclusion, they have really expounded and really have extended that mark as well. So as we learned today from Race as We Know It, we hope that you will be able to leave here with a shared analysis of the binary divisions and gain awareness of the history of race. And so we wanted to just remind you of the objectives of this year's town hall: race and attention, right? Healing the wound that will not heal itself. It takes a collective work from all of us to be able to do this. And so we hope that you like our objectives, and we hope that they were met in your eyes as you participated virtually with us. We would have loved to have been in a facility to where we could have had the presenters to have the microphone and they can really walk and really be engaging. But due to the pandemic and where we are currently, we felt this was be the safest place for us to be able to have this. So we hope that you have been able to learn something with our objectives, and that you have been able to see it and apply it, and that we have achieved what your expectations were of this town hall. Next up. So this brings us to the end. And as yesterday, I just wanted to reiterate some things that we did for you before we say goodbye to you. Some things that we wanted to remind you of. So we want you to continue to be intentional. As I stated before, early on in this town hall, what is learned here, we want you to share it. We want you to spread it. We want you to be able to not just be intentional, but we want you to put the action to it, because as we all know, some of us that are religious, faith without works is dead. So we want you to apply that action to be able to get involved, that you have been able to normalize, and that you have been able to operationalize with the equipped tools to be successful in your spheres of influence. And we want you to dismantle this information near or far to anyone that you feel that is going to benefit from this. And yesterday was our National Day of Healing, of Racial Healing. So please visit healourcommunities.org for more information on that. Also, this is just the second day within our Race on Equity Week, the City of Raleigh's Equity Week. Of course, you know, Monday was the MLK Observance Day, and yesterday we had our first town hall, and Human Relations had their event yesterday evening. This evening, I believe it's at 6 o'clock or 7 o'clock, will be the Equity Book Club. So please come and join us with the Human Relations Committee. Also today, I do know in Raleigh Municipal Building, there will be an art display of some of our Latino and Latina communities. Of that art display will be displayed in Raleigh R&B. So please, if during your time, if you have a free moment, just walk through the Raleigh Municipal Building and check out the artwork that is displayed there. And Friday is going to highlight our Black History Trolley Tours with Parks, Recs, and Cultural Resources. So we want you to be able to join part with them. They do have the sign up on their website. So please make sure you go and sign up for the different slots. If you want to know about the historical museums here that was contributed by the African Americans in the city of Raleigh, they have 5 different slots, 10, 11, 2 o'clock, and 3 o'clock. There's only going to be about 10 to 15 people that will be able to ride on the trolley rides, but they do go until 5 p.m. So we encourage you to, if you are interested, to please sign up. They are excited just as we are, and we want you to take part in that as well. Before I read these quotes, I do want to shout out again my awesome planning committee that did this work along with me, because without them, there would be no me. I would like to thank Letitia Holmes, Lisa Atsumi, Maisha Williams, Charles Craig, Megan Anderson, Travis McCullum, and Demetrius Edwards. I thank you all immensely for your support, your dedication, and your motivation, and just sharing of your knowledge and your ideas with me. Because y'all know it was a struggle to get here, but we are here. Nerves and everything, because I don't like the spotlight, but they trusted me, they pushed me, they encouraged me. My wife encouraged me, and I'm ever greatly appreciative of her. She may be online. I just want to shout out Nicole Atkinson. Yay! But I thank you all. I thank the team. I thank Marshall Adams, David, our city manager, Evan Riley, our assistant city manager and director of equity and inclusion, and our deputy city manager, Tansy Hayward, for their support, their encouragement, their push, their dedication to this work. They have been dedicated, they have been passionate about it, and we are where we are today because of them and great leadership and management. If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. So leaving here with intention and purpose and aim, the ability toward action to heal the wound that will not heal itself, we begin the healing process together, and we do so with intention. So we leave you with these quotes today one of them that I just read with Dr. Martin Luther King Jr. And the one of our core team members keeps us as a tagline as we remind us of the wisdom from a man that has inspired this Racial Equity Week and the other African-American proverbs reminding us how we will advance equity in the city of Raleigh. If you want to go fast, go alone. If you want to go far, let's go together. Love one another, work together, push the mark. Let's move forward. We do it better when we do it together. We thank you. We love you. We thank you for your time and your participation. And if you have any questions, please send them to us. If we left out anything that you would like for us to enhance on for next year's town hall, we welcome those ideas as well too. Again, we thank you and I thank you and have a great evening.